Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
These are difficult economic times for a graduating dentist to enter private practice. As a result, many recent graduates are taking a closer look at military dentistry. Here to discuss the opportunities the Navy has to offer are Lieutenant Melanie Frank, Medical Programs Officer for the State of Michigan, and Commander Ronald House, a career Navy dentist and resident in the Restorative Dentistry program at the University of Michigan. Melanie, what programs does the Navy have to offer?
Well, Joe, we do have an initial contract of 3 years in which the dentist will find a wide variety of professional practice, and this would include a guaranteed income during that time. Some of the advantages that the dentist may find in the Navy would be worldwide travel, and this would include the job-related travel that would be at no cost to the dentist or his family. There would be a 30-day paid vacation, which would also be included, along with the privileges that the dentist receives for the commissary and the exchange would be equivalent to a grocery store or a retail store in the civilian society. There would also be complete health care for the dentist. And we would have tax-free housing and an allowance subsistence with a disability coverage. Also, the opportunity to apply for the general practice residency program would be included as well.
What about the clinical opportunities, Ron, that would be, I would think, a major factor for a student sitting in class wondering about a career in the military? How do you view the clinical opportunities?
Well, Joe, I think this is really one of the prime reasons, for entering the military is the additional expertise, the fine honing of the skills that you've acquired in dental school. The attempt to enter practice immediately from graduation, you live under a economic cloud of being able to make your payments on your loans, your leased equipment, finding a practice opportunity, whereas the Navy will enable you to immediately begin practicing clinical dentistry in a variety of modes. Invariably, the recent graduate spends a fair amount of his time doing common operative dentistry, the nuts and bolts. But we also insist that the dentist spend time in various rotations to enhance his clinical expertise and to enable him to become a much more comprehensive dentist.
You mentioned all of these benefits of being in the Navy, clinical and then non-clinical, pay-wise and so forth. Is that listing a listing for a dentist on active duty as opposed to reserve duty?
Yes, Joe, it would be the active duty portion of which would include the benefits that I had listed. We do have the two programs, one being the inactive reserve program that is offered to the student while they are still in school, and the other would be the active program where they would come on active duty upon graduation.
Describe the inactive duty program, if you would, please.
Okay. It's a program for the dental student to receive an ensign in the Navy, to receive a commission as an ensign in the Navy, and this is during their time as a student in school. The actual curriculum is not affected at all, and upon graduation, this is when they are superseded to the appointment as a lieutenant. Some of the advantages, I would think, of this program is, one, having summer employment offered to them during the summer months between school, and also a job offer is already made for them as they're still a student in school. Another opportunity with this program is they do have a priority with geographic selection and also in applying for our general practice residency program. The final advantage I see with this program is after graduation they will receive an additional $1,150 for each year that they have participated in our program as a student while going through dental school.
So economically they're ahead upon entry.
Yes, yes. It can amount for the total 4 years up to $4,500 ahead of another individual dentist that is coming in after graduation and not having participated in our student program.
During the dental school period, do they have to do anything that's mandatory for the Navy? You mentioned summer employment possibility,
right.
But is there a monthly meeting commitment or a summer camp commitment?
No, there's really no commitment. They're on their campus, wearing the civilian clothes, living in on the campus itself, not affected at all. The advantage would be that the opportunity for summer employment is there. It is not required for them to attend. And these would entail various options of, one, our Officer Indoctrination School, which would be a 6-week course in Newport, Rhode Island. This would offer them the chance and the opportunity to feel the role as a naval officer. It would be a non-dental type coursework for 6 weeks. This is all during an active duty time where they receive full pay and allowances, and this would amount to approximately $1,800 for that summer alone. Another alternative they would have is to do a clerkship, and these would be at one of our many Navy medical or dental regional centers in the United States. They also may, here at these clerkships, they do receive what we call hands-on experience, and this is all done under close supervision. And Ron, you might have something to add on the clerkships itself.
In my handling of having clerks at dental clinics that I've participated in, it was a very enhancing experience, I believe, for the dental student, either in between his junior and senior year or between sophomore and junior year. When you've had a little bit of clinical experience in the dental school, we supervise closely, but this does not mean that all you're doing is going to spend your 45 days observing. We do ask for you to do some dental procedures, restorative procedures on your own, on the patient, but they are, of course, under a closely supervised condition. But you are given the opportunity to practice dentistry during this 45 days, or sometimes it can be as long as 60. Generally, I believe it's 45 days, but it's a very unique experience where the dental student is taken out of the clinic floor at the dental school, where you have all the checks and along the lines, and you have the opportunity to practice a little bit of dentistry, and it's a very rewarding experience. I think it.
I would assume then that a clerkship would be restricted to someone that is in the junior, senior year level, as opposed to someone that's between their freshman and sophomore year with minimal clinical competency.
That's usually the case. Now, the Officer Indoctrination School that Melanie mentioned earlier, which is basically a 6-week course teaching you the aspects of being a naval officer, is generally taken between your junior and senior year. It can, in some instances, be taken a little bit earlier, and that would allow you to have a clerkship. But most of the clerks that I've been associated with were between their sophomore and junior year.
If we assume that a student enters the reserve program as a freshman, they would have a summer between freshman and sophomore year, another one between the sophomore and junior, and then still, in some instances, in some schools, a summer between the junior and senior year. This would leave a possibility of going to a summer program for those 3 summers. Do you have different clerkships, perhaps, that individual would select if they were to come for all 3 summers for employment?
The clerkships, primarily, they attempt to be cost-effective to the government by allowing you to attend your clerkship at a naval regional dental center nearby your geographic location of your school or your home. If you're attending a school that does not have classes during the summer and you're going to be returning to your home area, which, for example, may be in California, there's nothing that wouldn't preclude the Navy from sending you for your clerkship at the region closest to your home during this summer. If you were going to remain here in the Michigan area, there's a good chance you would possibly be able to go to Philadelphia or the Great Lakes in Chicago, Illinois area, and work. I know one recent graduate of Michigan attended both Officer Indoctrination School and 2 clerkships during her 4 years of dental school.
Does the student have some choice as to what Navy base or installation that they can go to for the clerkship during the summer?
They may request, the region of their choice. It comes down to the financial question and the amount of funds available, the cost effectiveness to the government. We couldn't have everyone, of course, asking for Hawaii or for Japan, for their 6 weeks of, or 45 days of clerkship. But of course, we do try to give the individual an opportunity to select an area that's cost effective to the government to attend. The decision is the individual's. The Navy does not require a clerkship, and the choice is really left to the dental student, whether or not they will or will not attend the clerkship.
So in instances where a university has a summer session for students, they need not worry that they can't attend a clerkship then?
Correct.
They're selected. What about any disadvantages that you would see for the student to be involved in a reserve program?
I think probably one disadvantage we have right now is that there is no tuition aid. We did have a program at one time where the Navy was paying for their tuition. If that should come up again, each student that will be in our program at that time will have the opportunity to come under our tuition aid if that should come in the near future. Probably another disadvantage, Joe, would be the commitment is made very early in their school years, whether it be as entering as a freshman or sophomore. It is made at an early time, and this does affect their first 3 years after graduation, so that can also be looked at as a disadvantage. On the other hand, I think pulling it through on an advantage side, it does provide the security that a job is there waiting for them when they do graduate.
You mentioned the priority for reservists to get onto active duty by going through this. Is that an absolute guarantee?
It is a fact now that the Navy is bringing on the students after graduation onto active duty. There might be a few exceptions, and one would be if the student has not met with the physical requirements at graduation time. And another might be if there's been felony convictions along the way or a severe long delay in graduation where the timing is not appropriate to be brought on active duty until a later time after they graduate.
Is there a considerable length of time between graduation date and date of entering active duty?
Most often it will depend. If the student is going for a general practice residency program, it does begin in July, and that would be the restriction on the time allowing for them to come. I guess the school would end in May or June, and then they would travel with us in July. Otherwise it will vary. Most often you'll find the student coming with us during the summer months of July and August, even if they're not attending the general practice residency program.
Is entry into active duty predicated on passage of state boards or regional boards or national boards or anything like that?
It's highly encouraged that the student will take the boards. Any workforce dentist that does come into the Navy has to have a license. However, if a student enters our program on the level of a student, we have no way of knowing if that person will be licensed or not, but it is highly encouraged because at some point in their life they may not be in the Navy and they will have to have a license to practice. And it is much easier for the student to take those boards soon after getting out of school. So every student that does come with us, we highly encourage them to have taken boards. They do not have to retake a board at each geographic area that they move to. It can be kept with one particular state as they continue to move in with their military career.
What happens with one of the reservist types that we've been talking about that takes the board and is not successful and has a delay to retake it? Does that interfere with entry into active duty?
Not really, Joe. It will depend situational, individual level, but most often the opportunity will be awarded to the student to retake the boards, and then it would be taken action according to what the final results were at that time.
If I might mention something here, Joe, is the fact that in Navy regulations, the time permitted for state boards is always there. An individual may request and be granted leave time to take a state board anywhere. Now, he would, if the individual wanted to cross the country to take the state board, he would of course have to do this at his own expense. But the Navy will always give you the time to take the board for any boards. Now, they do fund any specialty boards. If you're specially qualified when you enter the Navy, the Navy will pick up the fees for all the specialty boards. But I know many people are interested in being stationed in Florida, California, whatnot. At most of the large clinics, there are active study clubs for procuring the board. And it's the majority of people that are in those particular two states invariably pick up the board in that state too. And the time is granted for them to take the board. And the patients are usually provided. It's nice to have the dental assistant provided to take your Navy chairside dental assistant right along with you to the board if it's in the area. That's also permitted. And the Navy encourages boards. Boards are something that is nice to have, and we look very favorably on the individual being licensed and having a
But
a
it
state
isn't
board.
mandatory
It's
to
not
practice.
mandatory. And no matter where you're stationed, you don't have to procure the board of the state that you're practicing in. You're practicing in a federal situation.
Earlier, you mentioned several advantages to being in the active duty program, and I would like to just shift gears for a moment into the active duty situation. You mentioned very briefly the general practice residency, and I'm sure that that intrigues students that are sitting there thinking about perhaps some continued educational opportunities. What is the general practice residency program in the Navy?
Well, the general practice residency is a 1 year, 1 calendar year. It begins the 1st of July each year. Hospital dentistry rotation that is a very challenging program. It includes a minimum of 6 weeks of assignment to the anesthesiology department. These programs are only offered in major teaching hospitals. And as such, as a dentist, you would be assigned to the anesthesiologist where you learn complete anesthesia. You do intubations. You do spinal types of anesthesia. You learn nitrous oxide analgesia. You actually, in the end of the rotation, you're simply in one of the operating rooms with the responsibility of intubating and anesthetizing the patient for major surgical procedures. It may be anything from an appendectomy to any type of surgical procedure. And invariably, just a little sidelight, I know I was involved in a general practice residency program prior to arriving in Michigan, and the anesthesiologists love to have the dentists on the rotation because of the expertise with the hands and the ability to work in a mirror made them very astute individuals to do intubations, and it was kind of interesting. But the program is a very challenging program. Like I said, it's at a teaching hospital, so the facilities there are tremendous. The library, the rotations, the consultants. Invariably, there are a number of dental schools surrounding the area, and their faculty are, of course, consultants to our programs, and it's a different year. It's not just a super senior year, but it's more of a year mimicking a full specialty residency, but you have the ability of being trained in a multitude of areas in addition to the anesthesiology background. It's an excellent boon. These are the people, they're handpicked. It's an honor to be a general practice resident. We only offer about 24 a year, and this is among the 350 or so new dentists that enter the Navy each year. We only pick this. It's a very select group, but it's a group we're proud of. It's a group that we feel confident at giving them independent duty assignments or assignments that call for much more responsibility once they've completed the general practice residency.
What does the resident have to do in exchange in terms of commitment to the Navy for that continuing education experience?
For just the general practice residency program, there's no additional commitment at that time. The initial contract excuse me, is 3 years, in which if they are in their first year of the general practice residency program, they only have a final 2 years to complete for their initial contract. There's no additional obligation after that.
What about other active duty experiences aside from the general practice residency? What kind of clinical experience can a typical active duty Navy dentist expect?
Well, I think initially, when you first report from dental school, they're going to, the clinic that you take part in is going to want you to pretty much get your feet on the ground, learn patient care and handling. We never sacrifice quality for quantity. You're not going to walk right into a situation where you're going to have to see 7 patients a day. Initially, we may say, take 2 hours per patient, do what you can. We pretty much try to keep the standards of Navy dentistry high. We attempt to even continue use of the rubber dam and a variety of other procedures to learn expertise in them, to hone the skills that you've learned in dental school. And we then, after you've had a few months of doing a lot of restorative, more or less getting your feel for treating several patients a day, we will then start rotating the new dentist through a variety of specialty areas. Generally, these are under the training of a board-certified or board-eligible specialist, and they're quite valuable assets. They're very nice. I know they're given credit by the Academy of General Dentistry for their point total that you need for fellowship based on military rotations in the Navy dental clinics.
I'm wondering about the ability of the Navy dentists that we're describing, the recent graduate, to make treatment decisions and have that supported by the Navy unit. Is there a restriction on what kinds of services can be offered? I think rumor has it that the military dentistry is somewhat limited in the scope of what can be offered. If a patient needs a Ceramco crown, can that service be offered, or are there restrictions on the caliber of restorative procedures that can be done?
Well, generally, we try to avoid any temporization, so to speak, in treating patients. We almost invariably insist that all teeth endodontically treated are cast restoration is placed. The porcelain is very much in evidence in the Navy. In addition, the majority of our ships at sea carrying dental officers now have full Ticonium Ticomat casting machines for partial frameworks and bake-on capability. We don't strictly limit you to resins and alloys, although I think the individual that can construct and carve a very nice, beautiful pin-retained amalgam can really do just about anything. And we do a fair number of amalgams. Of course, that's the bread and butter. Our restrictions are not that unlike a private practice situation. Every patient that walks in the door cannot afford porcelain, cannot afford full cast restorations. We have to temper this in the military. We try to do the best dentistry we can, and we insist on whatever procedure is accomplished that it be done in a very quality-oriented atmosphere of practice. And this many times includes everything from precision partial dentures to bake-ons. We're not too much into blade implants, but there are not very many areas of dentistry that we don't practice on a day-to-day basis in the military.
Melanie, a natural question is pay. What about pay for an active duty dentist?
Actually, the pay is divided into three divisions, one being our base pay, which is the taxable portion of the pay itself. Second division would be the allowance that is given to live off of base housing, which is an option to the individual, and also a subsistence allowance. Those two items themselves are not taxable. And then the final would be the special pay that the dentist receives, and that pay is offered to the dentist above the general officer pay. Initially on active duty, that dentist would be receiving a $1,200 special pay, and on the third year it would be $1,800 special pay, and continuing to go up as years continue on in the Navy service. I think generally speaking, and roughly, the individual can expect about $24,000 on annual figure.
In this year of 1981.
In this year of 1981, and just to keep in mind, about $5,000 of that would be the non-taxable portion.
What about sea duty? That's unique to the Navy. That isn't affiliated probably with other branches of service. Is that something that every Navy dentist can do or must do, depending, I guess, on their attitude about it?
It's something that every Navy dentist, may do, let's put it that way. We have to put into perspective the fact that of the roughly, we're slightly under 1,700 dentists in the Navy. We only have 245 dentists that are either assigned to ships or to the other branches of the Navy that mean separation from the family. namely duty with the CBs, the construction battalions, which may be placed anywhere in the world to build a runway, build a hospital, or with what we call the Fleet Marine Force. The Marines are a very integral part of the United States Navy, and as such, the Navy Dental Corps provides all of the medical and dental support to the Marines, and as such, you may be assigned to a Marine battalion based out of Okinawa, or based out of Iwakuni, Japan, or based out of the East Coast, Parris Island, South Carolina, a variety of spots. These are considered unaccompanied because in most of the cases when you deploy, your family does not go along. This isn't always the case, but like I said, this is only roughly 250 of 1,700 spots possible. And many of our ships that carry dental officers are ships that only carry a single dental officer, and we do not like to place an incoming straight from dental school dentist out on a ship where he is totally on his own right from the word go. We think this is
How
a
long
bad
are these tours?
You're never assigned to a ship longer than 24 months. That's the maximum length of time. Now, of course, in the 24 months that you're assigned, the ship may deploy, leave your home base, maybe 12 of the 24 months. The ships basically go either into the Western Pacific or go into the Mediterranean area once a year for 6 or 7 months, and then return for refresher training, yard periods. There are a lot of variables. Generally, you won't spend more than 12 months of your 24 months at sea away from your family.
So there is a separation from your family
There
factor
is.
to consider.
I think, though, that this brings up an opportunity for the spouse to do a little traveling by meeting the ship in various ports. A lot of the Navy wives get together, or Navy husbands, as the case may be, and go to the different ports to meet the ship. So it allows some traveling for the entire family. And I think another opportunity to travel outside of the actual sea duty would be being stationed in some of our overseas areas. And we have areas such as in Hawaii, Italy and Spain, Iceland, Greece, different opportunities that would allow you to really live and seek the culture of that particular area.
If these families are able to move from one port to another and follow the ship, so to speak, is it possible that some families would be stationed at overseas ports rather than stateside only?
Yes, it is, Joe. We have several ships that are home ported at the foreign shore, such as in Scotland, Spain, Japan, Guam, Hawaii, and the families accompany the husband right to the ship, and they live at shore. The husband leaves the ship every night and goes home. It's kind of a nice way to do sea duty.
It's nice that they have some kind of opportunity to keep the families together, because I think that's a major factor for the married couple.
It is a major factor, as well as with the married couple that are both on active duty, not necessarily being two dentists in the Navy, but they most often might have a different other type of job, but both being on active duty. And the Navy does go out of their way to keep the married couple together.
So that if either spouse is transferred to another location, they go as a couple?
Yes, they do. The Navy really makes an all-out effort at keeping the two together, both in their geographic location as well as the time that they do rotate.
Let's look beyond the 3-year commitment and think in terms of a career in the Navy, just very briefly. What are the kinds of things that could come to a career Navy officer that might not be available for the person that's just in a 3-year commitment?
Well, I think you constantly assume additional responsibilities, additional clinical responsibilities primarily, in addition to some administrative. But the career military dentist is also afforded the opportunity for graduate training in any of the ADA recognized specialties, either training at a civilian institution, such as what I'm doing here, or at the Naval Graduate Dental School in Bethesda, Maryland. And we initiate 40 dentists a year coming through formal training. It's a very unique opportunity and a very nice way to get your graduate training, specialty boards, whatnot, through the military, with Uncle Sam paying you your salary all the time. It's a very easy and a very rewarding aspect of a military career. And you also have to bear in mind that the career can be terminated at 20 years, which most individuals still have a very active life remaining, the opportunities for other possibilities after the military retirement.
Thank you, Melanie. Ron? Our guests have been Lieutenant Melanie Frank and Commander Ronald House, officers in the United States Navy. Join us for other programs in this series that are designed to assist you in making informed choices in your dental career.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.